So, Dr. Johnson, as far as flu season, it is approaching very quickly. As of Monday, the flu shot is now available for the province of Alberta. Predictions are saying it's going to come early and it's going to come hard. Obviously, the province is better prepared this year, would you say?
Well, just to answer your first question, influenza is circulating but at a low level now. It will come this winter. We think it might be a bit early, but we don't know. And we don't know for sure if it's going to be bad. But really, it's bad every year. It makes so many people sick. It hospitalizes a lot of people, and it does kill some people. So, even in the last year, there were about 4,000 lab-confirmed cases, and that's just the tip of the iceberg. And there were 1,200 hospitalizations and 30 deaths. So it's bad every year.
We ran out last year. Now this year, 2 million doses have been ordered. So kind of lead us to what that means.
Well, what that means is two things. There's a lot of vaccine. We have lots of vaccine. So the supply isn't an issue. And in fact, if people really came forward in even higher numbers than what we're hoping for, we could get some more. But then the other thing it means is that we're really, working and hoping and asking everyone to come forward for immunization. So we have a goal of immunizing 45% of the Albertan population. Now, just for comparison, 27% last year were immunized.
Right. And the 2 million doses, it does account for about half of the population of Alberta, correct?
That's correct.
Okay. So you're aiming for 45%. Now you get the same people. There's always the fence and a lot of people that sit on it. And then there's people on one side that swear by the flu shot. And then you've got people on the other side that think it's the devil's spawn. So what is your idea about that? I know a lot of people don't necessarily know how it works. I know people still think, oh, I get the shot and I get sick. Or a lot of people say, what is it actually protecting me from? So could you maybe answer a couple of those questions?
Sure. Well, you will not get ill from the shot. The injection there is no live virus at all. You can't get ill from it. You might get a little bit of a sore arm following the shot, or you may develop a headache. But other than that, you're not going to get influenza from the shot, from the injection. For the nasal spray, it is much weakened live virus. So and it is targeted towards children, mainly 2 years to 17 years. And sometimes there will be a bit of a snuffly, kind of runny nose, or mild cough after for a couple of days. But that is not in any way, shape, or form the typical flu type of syndrome. I don't know if any of your listeners, I know your listeners, some of them have had influenza. If you've had it, it is awful. You have a severe headache, really painful muscle aches, you develop a cough, and you feel, very, very weak, sometimes for a couple weeks after.
And a lot of people say, well, I'm good. Somebody in, say, their 20s, 30s, 40s, 50s, they think, okay, I'm still working, I'm strong, I'm healthy. And I know a lot of times you focus on, the immunocompromised or the elderly, but it can wreak havoc on anyone and result in, a loss of wage or anything like that when you're having to take that time off, because there's a big difference between the flu and a cold.
Absolutely. If you get a typical influenza, you're really flat out for a minimum of about 3 or 4 days. And sometimes, as I said, you're really, really super tired, fatigued for a couple of weeks after, and you just can't maintain that normal load. So anyone who's got, virtually every worker, everyone who's looking after families, any poor student who's trying to, get their exams ready for their exams or their papers done, you know how devastating it is to be unable to carry out responsibilities for a couple weeks.
The people that swear by the shot, they're going to get it. That's great news as far as what the expectations are with Alberta Health Services. Now, for those people that, like I said, think it's a horrible thing or they're still unsure, what do you have to say to those people?
Well, I wish I had the key to convince people of the benefits. But you know what we're really asking is to not only think of yourself. The immunization is still our best preventive strategy so that you personally can avoid getting influenza, but also think about the people that you live with and work with. Infants, particularly those under 6 months, can't be immunized. And small children, particularly those under a year, are at high risk for severe illness, hospitalizations, and occasionally deaths. It is a bad disease. Similarly, anyone who is got chronic medical illness or immunocompromised, and the elderly, they're at really high risk, and they need our help to keep them well this winter.
Well, thank you so much for joining us today, Dr. Johnson.
Thanks for the call.
And I hope you remain healthy throughout this flu season.
I hope you do too. Thanks.
Thank you.